If you've spent any time watching the news lately, you've surely heard some of this.
The breaking news, an Ebola scare in New York City. Doctors now awaiting the results of tests on a man at a major Manhattan hospital.
Chasing down Ebola as reports multiply about possible cases showing up in this country.
Breaking news on the Ebola outbreak, the CDC declaring a level 1 activation of its emergency operations center.
The head of the Centers for Disease Control calls the Ebola outbreak an unprecedented crisis. The World Health Organization calls it a public health emergency. But at the same time, there's concern that fear and misinformation are making the crisis worse. One WHO official actually brought that up earlier this week. I can hardly think of a more important topic for reliable sources. So let's examine the media's responsibility here with CNN's chief medical correspondent, Dr. Sanjay Gupta. Sanjay, you've been on the air seemingly nonstop. So how do you get the balance right? How do you inform viewers without needlessly scaring them?
Well, you know, there's sort of the two extremes, right? There are people who are really sort of nurturing that hysteria and be very irresponsible, especially on a story like this. And the other side, the other extreme is people are completely dismissive of fears, very clinical, just presenting the science. And as you might guess, I think the right way for television is somewhere in between. Obviously, making sure the science trumps it. So I think it's important to acknowledge that people who are very thoughtful, considerate people who've given this a lot of thought, can still have fears, and not to just dismiss those fears outright, because I think people sort of tune out if you do that. So acknowledge the fears, maybe even acknowledge where some of these fears come from. It's in our collective consciousness through books like Hot Zone and movies like Outbreak, and all that we've ever heard about Ebola has been bad. But then to acknowledge that fear, but then really make sure you bolster it up with the science and make sure that science is actionable. Here's the science, and here's what it means for you. And you know, it's a teachable moment, I think, if it's done properly.
How do you think the media has performed overall so far? I think sometimes the words that come out of the mouths of anchors are very responsible, but sometimes the graphics, the packaging can make it seem more frightening than it should. How have you, perceived the coverage so far?
Yeah, I think that's a real concern, Brian. What you're saying, sometimes a disconnect between what people are hearing from the people on TV and what they're reading in the banners, and I think it's a disconnect, frankly, probably for all media organizations. I see them all make these mistakes. I saw banners coming across very responsible news organizations saying Ebola going to spread like wildfire in the United States. It had nothing to do even with what the person was talking about. So that can be a problem. And I think when it comes to these medical stories, it's even more of a problem because people, it's actionable. People like read that stuff and then they have some particular opinion, or they may take some action based on that. So we try to have conversations with the shows ahead of time that when I'm doing segments to make sure that doesn't happen. But it's a real concern.
Let me play a clip from my friend Pat Kiernan. He's the morning anchor on New York One here in New York. Full disclosure, my wife works with him every morning, and he was doing a priceless moment of media criticism. He showed all of the New York papers right when there was this report of a possible patient with Ebola in New York. Turns out it was not a case of Ebola, but let's play that clip and then discuss it.
A19, down below the fold, the headline says, Ebola symptoms a concern in city hospitals. Let's compare this to the tabloids. Ebola! Ebola scare in the city!
So you've got the New York Times on one side, the tabloids on the other. I kind of thought the press in general blew this way out of proportion because health officials in New York made very clear right away it was unlikely that this was a case of Ebola. And then a few days later, we found out for sure it was not. What did you think of this case?
Let me give you another layer to that even, and that is that even before that patient went to Mount Sinai and we got all that coverage, there had been 6 other patients tested around the country who went into their hospitals with concerns about Ebola. Their blood samples were sent to the CDC, and they were all negative, but you didn't hear about them. So the only reason I bring that up, and I think it was interesting to observe this, is that the New York hospital, before the Department of Health came in and said, look, let's slow this down. This guy does not look like he is high risk by any means. The hospital had already done a presser. They'd already sort of put it out there. So I think this was a situation where in some ways, because the hospital had started to really put the message out there about this patient, the media's ears sort of perked up. Wait, We didn't hear about it with the other 6 patients. All of a sudden now the hospital is saying this. Is there something more here? And, you know, I think that really made it take off. I will say one more thing, Brian. You do such a great job when you do your stories about adding these layers to the story. I find them colorful, I find them important, and I find them something that I wouldn't often hear. I think the layers to this story are really essential, really. You can't do this story without adding the layers. Like in that clip you just showed, just the headline, that's a real problem. But adding one more layer over that is absolutely essential. Tom Frieden, the CDC director, says Ebola is going to come to the United States. That's the headline. The second line that he says right after it, but it will not cause an outbreak in the United States.
That's the more important line right there, yeah.
You can't have the first without the second.
Dr. Sanjay Gupta, thanks for joining me.
Anytime, Brian. Thank you.